Hi, my name's Juhan, and I'm going to talk a bit about how I got into the designing of health. And if you want some bedtime material, you can check out the URL here, and you can look at the PDF at home. And like Joshua said, I design, or at least I pretend to be a designer. I'm recovering. That's what gives the scarf as a giveaway. I also teach at MIT. But I had no clue about my health about almost 8 years ago, like most men were in denial about it. And I had a unique opportunity that many of us who work at big companies do, and I had a cholesterol check. The nurse came to me bug-eyed, amazed that I was still a functioning human being with this massive score, but she didn't know I had this huge organ meat lunch a couple hours beforehand. But what's sort of scary is that I didn't even have a pulse on my health. And when you bring your car into a mechanic, you put a probe in the car and you get 2,500 metrics. You put a probe in my tailpipe, you're lucky to get one, right? So I think we're familiar with the problem set is that we as a species are really good at linear thinking and thinking about the next day, the next month, not at the long now. And we're dealing with more and more complexity without actionable metrics. So how do I, as a patient, as a clinician, make more accurate decisions? So let's do a little game show here. Find the patient in this electronic health record. Raise your hand when you find the patient name. Okay, so there's Catherine. The probably most important piece of identification is smaller than a gnat's ass, right? This is criminal. So, a few of us at the time said, okay, this is, a disgrace. We need to start designing something just to understand our own health, let alone someone else's. So we started sketching. A lot of these are bad. Yeah, whatever. And then I actually had a checkup the first time in 6 years. But then you go through this. Many of us have gone through this as QSers. The doctor's back is to them. They're huddled over the machine. They're like this, and they really give a shit about you, right? So how do I become a little more informed? Well, this birthed the health card. And this was at least my first take at what I thought I wanted to have in my back pocket with me all the time. And this is how I actually tracked myself for many years. And it actually showed not just a single chalk line of your health, but the continuous assessment. That's what makes health more interesting. And then I did this for my whole family. I got a little crazy about it. So what were the outcomes? Well, two things that I think were big were the fact that if you didn't have beautiful data, you sure as hell couldn't make anything beautiful design-wise. And most of health data sucks, right? And not just what lives at the hospital or in the clinic or in the back of the truck, whatever you visit in Walmart, but the standards, there are none, pretty much. There are no good data standards. So we had to get, as a crew, we got into the data standard game. That's a whole separate conversation which requires more drugs and alcohol to talk about. What's actually funny about HealthCard is I was at the QS conference in 2011, and the one of the chief architects for WebMD came over and says, "Hey, I recognize your face." And I'm like, "Okay, great. It's pretty ugly." And he goes, "Well, no, it's because we use HealthCard for their back end visualizing all their patients." So I thought that was pretty funny. It's like this serendipity of open sourcing your design, which most of the things you'll see in here are open source, licensed under Apache or MIT. So then we actually went to the hospital, and we kept and viewing what happens with the shears, in the surgery wards at MGH and Beth Israel. That's an amazing experience if you can actually see clinicians in practice. We kept evolving this. It got worse and got better, and we kept going a little bit. But then we said, well, look, if we're trying to measure our health, what's the first thing, the building block of health is pain. If we can't actually start measuring this, we shouldn't be designing this in the first place. So we came up with another open source app called Pain Tracker. It's available here. Not that many people use it. We've done like zero marketing or negative marketing, but it's just an exercise for us to figure out how to measure it. Some of the outcomes here is that the biggest one is that both clinicians and patients said, "I want to sketch my pain." That's how I do it now. I want to almost like a paintbrush on my body. So we're actually working on an open source. This is usually just sketches, a way to look at to input pain by painting it. It's called Pain Painter. And you can actually see the tracking over time. And this gets released at the end of the summer. Again, open source. Now, let's pretend for a second that you don't live on Wall Street and this is like how your universe is constructed, but one that actually is more true. there's a lot of, in the quantified self movement, there's a lot of focus on these little small projects, which are fantastic for us to understand your body and biology and health. But also, I think you need to diversify your idea and gene pool a little bit by saying, well, great, we can play here in the commerce or design space, but really where you have more thicker and bigger responsibility and impact on Spaceship Earth is down on the governance and culture jamming level, right? It takes a lot bigger time investment, but I think there are benefits there. We started working at the HHS level to say, okay, every United Statesian needs their own health card with maybe an ID that's unique and enduring. Your social security number, not unique, you're not enduring. What if we had a 1040HC? Don't freak out yet. As part of your taxes. What part of your data is open for planet Earth? California has 7 different sexes, by the way. So as also part of this, to get into the governance game and policy game, these are some of the things we've done over the past couple of years. You have to keep churning at how do you change law? How do you change the data standards, which we also are in with HL7 and some other fun tidbits. But you have to sort of work on multiple levels in this space, I think, to have some kind of impact. And so the culmination of this is a project called HGraph, another open source project, where we want it to be both clinically and patient relevant, where your health is in one picture and that you actually have a scoring system for how well or how not well you're doing. And for some reason this one's blowing it up, but here, sort of the green zone, right? Not unlike the Iraq green zone. Actually, there was no such thing as a good zone in Iraq. But if you happen to be in the green zone, you're good. If you're out, inside or out, not so good. So instantly you have a single picture that aggregates all your data. And there's a score in the middle, a big fat score, which you can't sort of miss. And here it is on the iPad. And you can dive in. I don't know if you're familiar with Eames' 10 by 10 movie, did decades and decades ago, where you go from the galactic to the atomic. This is the same concept. You can zoom into the record and get more data, see it over time. This is actually all my data. This is all real. It's none of this fake. So it's also been open sourced, just like my genome is with PGP. You can see family and friends. And if you do the 2-finger swipe, you get the histogram view where we start to condense time and non-linearize it. So here's the histogram view of my health. This is fudged because I don't have diabetes or high blood pressure, but it's just the example. And then here it is on my mobile phone. So why am I showing you all this? Well, what I think gets more interesting here is target ranges of where you see all your data and that scoring. So there are a ton of different gold source pieces of data out there. None of them, I think, are the thing. And they give you some kind of basic algorithm for where your score should be. So we said, okay, look, we don't want just one single organization owning that gold source data. We want to democratize it and have a national scoring system for your health. Like I mentioned, like I showed you, that 0 to 100, just like passing or failing in kindergarten or first grade and university. We want that same kind of scoring technique and an algorithm that not just Yale has, not just MIT, not just Beth Israel, not just MGH, but an entire package of organizations that are allowed to participate and create that score. Why is this working? There we go. So what are we doing? We're releasing in the next 2 weeks hscoremixer.org, and that'll be probably take a year and a half to actually germinate into something that comes close to some kind of national scoring system. And I also should mention that every single Apple and Facebook employee will be using HGraph as part of their citizenship starting in the end of the summer. The company that's running all their clinics is using HGraph. So what's coming next? Well, I talked a little bit about pain and pixels and policy, but really the fun stuff is in the proteins, which Preston started to talk about a little bit. And that really gets us to an area of stage 0 detection, where we are finding things before they become manifested on ourselves, where we can actually see it. Before the cauliflower grows in your shoulder and goes, my God, what is that? You are seeing it at a much different scale and catching it way, way, way early. So those are a few things that we've been working on for the past couple of years. If you have any questions, fire away.
Thank you.
Yeah.
Thanks. I think what you're doing is very interesting. I'm PGP 7, so
Okay.
The challenge I see when you start providing these metrics for, say, a fingerprint of what's a good value is, don't you incur liability for what's the revenue stream that you see from there? It has to be self-sustaining.
Oh, there's two parts to that, or actually way more than two parts. But the underlying one is one of trust, right? Which is if I remember Steve Jobs, when he did, when you do this kind of scoring technique before they found the pancreatic cancer, he'd probably be, an 87.5, right? But lo and behold, there's something inside, and you don't know. So again, this is in the primordial ooze stage of the development of the algorithm. So I think when you start to massage it with more interesting data, like the genome and all sorts of other good things, you're going to get higher and higher and higher fidelity over time. So I'm not saying by any means this is like anything beautiful, amazing yet in terms of truth. But we need something in order to validate or say, are you failing or passing? Just as fat, dumb United Statesians, we all need some kind of like flag to say, not so good. Right? I think so. That's the moment here. You get into a much bigger question, which, again, probably requires a lot bigger answer than what I just gave. Go ahead.
You talk about the number, the 84, but how much of what you've been doing applies to clustering people or measuring distance between two people, so that you can develop a concept of subpopulations? Is it a completely different issue, or is what you're doing informing that aspect of it?
Well, I think the answer is I don't know yet. One. Number two is I think just by doing some of these experiments on campuses, trying to obfuscate the data, but on certain corporate campuses, you can easily see how geo has a massive effect on health, right? Both in terms of how we network with each other, right, and how I hang out with healthy people or not. That's one part of your question. The other is, have we measured yet the effect of geo? Not yet with this. We're just rolling this out. Well, when I say we, the company that we did this for, are just rolling this out in a couple of months to clinics, so that we'll have a much better view of what and be able to see patient data and patient scores in just a few months in terms of how they affect the geo. We have some early data, but I don't want to give you a untruth. Yeah.
How did you get somebody to buy into this initiative? How do you
Which part of it?
You get companies who are adopting this sort of metric and this way to look at health.
Yes.
Companies that essentially own their own health plan, right? Running their own plans.
Yes, some of them, yes.
What was their motive in going down that route? Because that's sort of the block I see between quantified self and healthcare. There's a wall there that healthcare essentially doesn't care about your health.
Okay, so why you're seeing, I think, adoption at the corporate level is pretty obvious, right? Is they are spending a metric ass ton on health insurance, right? Technical term. And so what they want to do is they want to drop that number that they're spending on patients, right? In order to increase their bottom line. So they have a self-interest at heart for making sure that people are in part of that routine. So when you look at the Apples and Facebooks and IBMs and all those cats who have clinics on their major campuses, they're actually now requiring everyone to go get a checkup once a year. Okay, I think that's not a bad forcing function. Now, some people are going to cry wolf because they're like, oh, my data is not private, and your data is not private anyways. It's a whole separate conversation. But there are some interesting HR problems there because it only takes one or two pieces of data if you're in the firewall to identify exactly who you are. So you have to be very careful of how that data is being used, and we don't have any national laws against the pejorative use of your health data, another criminal thing that is going on in this country, which is insane. So anyway, sorry about the rant.
Last question.
Yeah.
I'm curious, so your health graph score, like, are all the components equally weighted? How do you determine the weighting for each component of that score? And how do you determine that weighting? And how does each component affect the total score differently? How equally weighted?
The answer is there's a particular rectal orifice that we used at the beginning to pull that algorithm out of. Now,
That's what I was curious.
that was V01. And then we had, a half dozen clinicians come in and say, okay, well, we need to, like a mixer, they need to, change that up a bit. And we had only about a dozen clinicians give their POV on what the scoring technique should be. Not nearly statistically, good enough. So that's why we're making H-score mixer, so that anyone on the planet, and also anyone who's been part of the AMA, a doctor, and they can authenticate into the system, also with organizations. And that's how we hope to get the algorithm better and better and better and better over time. So good question, and there's weighting in there as well. I'm pointing to, like you're looking at the UI. There's weighting in there as well. I'm not qualified enough to do that, so that's why we're opening it up.
Cool. Thank you.
Thanks.